from Omaha's news leader. This is KETV News Watch 7's Chronicle.
Good morning, I'm Quinicia Fraser. The holidays may be over, but the fever, coughs, and muscle aches are not. Based on thousands of tests across CHI Health hospitals and clinics, nearly 1 in 4 flu tests are now positive for influenza A, and it's what's driving the worst illnesses in our community.
So we're expecting over the next 2, 3, 4 weeks that the influenza levels will just continue to rise even higher than the current very high levels.
According to CHI Health, about 20% of flu tests were positive during the week of Christmas. New Year's week, nearly 25% were positive. Health officials say we've experienced the highest level of respiratory illnesses in 25 years. We'll be speaking with an infectious disease expert from the CHI Health later in the show. But first, I have some shocking statistics to share. According to the CDC, during this flu season alone, there have been more than 230,000 hospitalizations across the country and more than 9,300 deaths, including 32 children. That brings us to the new recommendations for children's vaccines from the U.S. Department of Health and Human Services. They're taking influenza off the list, saying kids no longer need some vaccines. Chronicle's Pete Cudahy gets the facts on what it means for your loved ones.
Medical experts are worried that removing recommendations for vaccines for children will lead to a lack in public trust.
For the first time since 1991, the CDC will not recommend all kids get vaccinated for hepatitis B.
I can't think of a plausible reason why they would do this.
It's one of many shots left off the CDC's immunization schedule recommended for all children. Ann Anderson-Berry, a professor at UNMC and pediatrician, is concerned about the effect the new schedule may have on the public.
The CDC is trying to erode trust in vaccines, and that will be devastating for our country.
The schedule still recommends some vaccines for all children, like measles and chickenpox. The CDC says the recommendations come after reviewing the vaccination schedules of 20 other countries. But Anderson-Berry says the U.S. is unique.
We don't have guaranteed health care coverage in the United States, and we don't have prolonged family leave when a baby is born. Therefore, we need to use vaccination as a public health measure to ensure that babies stay safe.
One Omaha mother believes removing recommendations may make people fearful of vaccines.
With the rise of diseases and stuff, it could be detrimental if people are scared of vaccinations because we have a long history of their success, but I guess it's too soon to know.
As for Anderson-Berry, she will continue to recommend vaccines like RSV and hepatitis B, even if the CDC does not.
I think you'll see the majority of pediatricians, family physicians, internists moving forward with the traditional recommendations for vaccination.
Anderson-Berry says that there are hundreds of reasons why these vaccines were recommended in the first place, and she's worried that with less children getting vaccinated, more people will be in the hospital. Reporting from the newsroom, I'm Pete Cudahy, KETV News Watch 7.
And joining me now to talk numbers here in the Metro is the Director of Douglas County Health, Dr. Lindsay Hughes. Dr. Hughes, thank you for being here.
Absolutely. Thanks for having me.
Yeah, so let's talk about the vaccine recommendations for kids. How do you feel about the influenza vaccine being removed from the recommendations?
We continue to recommend that flu vaccine for anybody over 6 months of age. It is such an important protection for the public, especially with years of research and kind of watching what flu trends do. We know that it's effective. It helps to prevent those really severe illnesses that lead to hospitalizations and death as well. And so we continue to go ahead and recommend that, just as we heard from Dr. Anderson-Berry earlier in the show.
What specific trends are you monitoring in Douglas County, and when do you anticipate the peak of the season?
Good question. It's a little hard to know right now because we are actually kind of in the middle, if you will, of whether things are going to go up or come back down. We're kind of in a transitional period. A lot of experts are saying that they expect the rates to continue to go up. Certainly we've seen kind of 1 week we're up a little, next week maybe we're down a little. So it looks stable for the most part at this time, but that does not mean that things couldn't continue to go up in the next few weeks.
Yeah, and influenza A seems to be more prevalent. Can you explain the difference between influenza A and influenza B?
Absolutely. So there are actually 4 different types of influenza, A, B, C, and D. We very rarely see C and never see D in a human. So A and B are really what we worry about. A, as you just said, is much more common than influenza B. A is the one we typically see earlier in a flu season. It causes usually more severe illness, lots more people get it, and it actually mutates a little bit more than that type B. So the type B tends to stay a little bit more stable, and it's because it has fewer proteins that can kind of mix and match. And people typically get less severe illness with type B. We usually see those spikes happen a little bit later in flu season, more toward the spring. But certainly not every year we have a lot of it. Sometimes we have way more B than A, but that does not seem to be the case at the moment.
Yeah, definitely not this year.
Yep.
Does the flu shot protect against all strains?
It doesn't protect it against all strains. Typically what happens is we watch and see what's happening in the southern hemisphere to understand what flu is going to look like for us in the northern hemisphere for an upcoming flu season. And so researchers have to make a choice how to build that vaccine based on what they're seeing in the southern hemisphere for different different subtypes of influenza. So they make a prediction and then they make the vaccine based on that. So it doesn't always protect against every single strain that's out there, but it does some good. So this year's match is what they're saying is a moderate match, if you will. And that's not uncommon to see a moderate match in a flu year, and that's because some of those type A's like to mutate a little bit, which is what we see this year. That you hear about the K subclade that's out there, and that emerged after we'd already made all of our choices for the kind of strains we wanted to put in the vaccine. However, it's a drift from what we've seen before, but there is still some protection. So we absolutely recommend people continue to get those flu shots to prevent hospitalization, severe illness, and even death.
Do you know the percentage of people here in the metro who have already gotten the flu shot for the 2025-26 season?
Unfortunately, we do not. We do not have a great way to collect that data. It's not required that physicians or pharmacies actually report those numbers, and so we don't have a very good way, unfortunately, of knowing that. We can ask for data, but typically we're not getting that data like from our state influenza or vaccine system until a year later. So it's impossible for us to really know right now what that looks like.
As someone who works in public health, how vital is that messaging when it comes to all of this?
Oh goodness, it's so important to just continue to educate and help people understand the importance of the flu vaccine and how it does help to prevent the really, really bad outcomes from influenza that can occur. This is something that we see every single year happen. We see hospitalizations and can be pretty significant numbers of deaths every year. And so it's just so important to continue to educate on that. And if people have questions about it, we welcome those questions. We also encourage people to talk to their primary care provider or a trusted physician who can really walk them through kind of the decision-making process in terms of deciding to get that vaccine.
When it comes to, flu outbreaks, what concerns you the most?
It's always going to be, that there are vulnerable populations who perhaps are not protected. So if we have elderly who are not protected, but they tend to get much more severe disease, certainly we worry about that. We also worry about our kiddos because we can have, of course, under 6 months of age, not even eligible for the flu vaccine. And other kids who typically don't get the vaccine and maybe have some issues with their immune systems. It could become extremely ill, or even, as we saw, there have been a number of deaths already in pediatric populations in the United States this year. Luckily, we haven't had any here yet, but that's something, of course, that we're always watching. But it's really having high amounts of that virus that's circulating in the community and not having the protection for people to lessen the severity, lessen the amount of virus that's circulating, and really giving that protection. So we continue to recommend that, along with all of the other things that you can do to prevent getting the flu, like good hand washing, staying home when you're sick, and just being mindful of being around other people who might be sick at this time of year.
Speaking of protection and prevention, what are the most accessible locations that Douglas County residents can get the flu shot?
Great question. And it is still available. So some people think, oh, I didn't get it in...
It's too late.
Right. I didn't get it in October. What do I do now? You can still get that flu shot. You can go to just about any pharmacy. You can go to a primary care provider. You can go to your health system. And all of those places are still offering that flu shot. So we definitely recommend people get in and get that done even now, because flu season isn't going to be over for at least another few months.
Dr. Hughes, thank you so much for joining us today.
Absolutely. Thank you.
Next on KETV Newswatch 7's Chronicle, an infectious disease physician in Omaha weighs in. Plus, how Iowa testing centers are lightening the load for emergency rooms.